for municipalities across BC. Why this applies specifically to community social services is through the COR program and our training program. We do customize our training and also our auditing to different sectors, depending on if they are involved in our COR program, such as community social services, which I'll get to in a little bit here. When it comes to the certifying partners, BCMSA again is one of the certifying partners through WorkSafe BC that is authorized to administer the COR program throughout BC. So when you look at us specifically, we do represent municipalities, but the really cool thing is we do have naturally aligned organizations that do align with us. So again, that would be community social services. We have community care services that typically do come throughout the BCMSA purview, as well as school districts. And why that's important today is because and Sat did a good job of kind of outlining this earlier as well, is that we have actually taken our municipal audit tool that was focused totally around municipalities, and we have customized that specifically to the community social services sector. So anyone that is taking our training or anyone that is using our audit tool, so if they're certified or even doing a gap analysis, they will have the ability to use a tool that is specific to your sector and your industry and talking your language. That was something really, really critical. And thanks again to the working group. It took a lot of time and effort, but something that we felt was critical and needed in order to make that impact throughout your guys' industry. And secondly, the really cool thing that we've done recently is we've updated all of our material to speak the same language of the community social services sector as well. So any of our manuals, any of our booklets that we have coming in that are specific to our trainings or workbooks per se, all of that has been customized and is exactly to the need of our audit tool and specific to your industry. So we have 4 courses that are coming up this year, quarterly throughout the year. Anyone that is taking that course free of charge through the community social services sector and wants to become an internal auditor through the BCMSA will be using an audit tool that is specific to the industry. And I did want to make a bit of a mention too regarding the certifying partners. Again, the BCMSA does represent municipalities across BC. That's our primary focus, but we do have naturally aligned organizations. So if you're unsure as to who your certifying partner is through the naturally aligned organizations, you can go on WorkSafe BC, and there's a search function through their website that you can actually type in your CU number, and it will align you with a certifying partner. Because you are community social services, I would say that a large portion of you do come under the BCMSA purview. But if you do need more information, please reach out to WorkSafe BC or simply just go on their website, type in your CU number, and you should be able to get more information regarding that. So what is COR, and why are we talking about that today? COR is a voluntary incentive program. So by no means is this a mandatory program that is mandated through your sector and organizations. It's a voluntary incentive program that promotes best practices. So it goes above, typically the way that the philosophy around the program works, it goes above and beyond the regulations, but is not a compliance audit by any means. It's recognizing and rewarding employers who develop and implement a health and safety and injury management systems that, again, exceed regulation. So it's really what Sat said before is talking the talk and walking the walk, and really implementing different procedures, programs, philosophies, and policies throughout your organization that have gone above and beyond what a typical regulation would look like. And what is the role of the audit tool, specifically in the whole COR program? So the audit tools, and we've got some points here, it's to measure effectiveness of systems, review at least 1 year's history, and enables the employer to improve the systems. So really what's happening is when you go through the BCMSA audit tool, you'll see a ton of guidelines that you've got to answer. But basically what that looks like is you're going to shape up your health and safety program, your procedures, and your policies, and you're going to measure them against the different guidelines that you have throughout our audit tool. And from there, you're going to review at least 1 year's history. So what we do is if you are going for the COR audit and you would like to become certified through the BCMSA, you're looking at least 12 months of history to ensure that all of your procedures, your programs, and your history of health and safety information is relevant and recent. So you're not typically looking at, you may have a ton of programs that you built in 2017 and 2018. Typically, we want to ensure that all of that has been reviewed from at least 1 year to ensure that it's current and it's being used by staff on an annual and a regular basis. Secondly, why would you conduct an audit? Some of the things that we would like to outline is that you're providing feedback. So you're looking at the strengths and weaknesses of your health and safety program. You're looking at strategies for continuous improvement. And that's the philosophy around the CORE program as a whole, is that you're not just looking at kind of a checklist and saying, okay, I've got this program, I've got this procedure, I've developed these statistics for health and safety. You're looking to review and update these on an annual basis. And you're showing that there's continual improvement throughout your health and safety program. Sad hit this on the nail, and this is one of the great questions that we have today, is that you're promoting and enhancing safety culture. So you're not just looking at it from a worker perspective, a supervisor perspective, but this is from the top down, basically. And you're saying that management's involved, you've got managers, supervisors, workers, and everybody's looking at this from a holistic approach and really promoting and enhancing health and safety throughout the workplace. And it's assisting in achieving CORE. So that's the other thing. When you are doing an audit, not even necessarily the CORE audit, but a gap analysis, typically you are monitoring and evaluating health and safety systems. So if you're doing an audit and you're coming up with recommendations and ways to improve your health and safety management system, that's a way that you're moving closer and closer to achieve CORE. And I will mention this a little bit right now because we're talking about audits, and we'll probably talk about this a little bit later in the presentation. But when you are becoming certified through the BCMSA, and you can find this on our website as well, is that you would need to be certified through an external auditor. So typically, you would go on the BCMSA website. You'll see that we have 14 approved external auditors for BC. You would need to choose one of those folks to be one of your auditors, and they would come on site and conduct that audit for you. And from there, you would have the ability to do internal audits or use an external audit every year that you choose to do an audit. But I'll talk about that a little bit later as we move forward. So again, I like to hit this home because we get a lot of questions around this throughout the year, is that the CORE audit is not a compliance audit. So you are not auditing based off the WorkSafe BC regulation per se. You are auditing based on the CORE standard and guidelines that have been embedded in our CORE audit tool. So when you are going through your CORE audit, whether again it's your certification year or your maintenance audits, which is years 2 and 3, you would be going in and you would be auditing against the audit tool, which has all the guidelines and the CORE standards and guidelines embedded in there. And from there, you would score it appropriately. And it's not an inspection of facilities. So as you'll see, as you move forward through the CORE audit, there's 3 main verification methods that you need to do: documentation, interviews, and observations. The inspection of facilities comes under the observation tab, but it is not the entire audit. So you're not going in and inspecting every single facility within your organization during a CORE audit. You could choose to as part of the observation piece if that's what you want to do as your wish, but that is not a requirement by the CORE audit. I like to bring that up because it's a question that comes up, and we do have a lot of confusion around folks coming in and saying, well, do I have to go in and inspect every single thing throughout my organization? That is not the requirement by any means. There is a certain percentage that you would need to do each year, and that's what we'll get to in a bit. So a little bit about the CORE process. So as you being a naturally aligned organization through community social services, number one thing is you want to confirm eligibility. And the way that you do that is you would contact WorkSafe BC. So if you're looking at becoming CORE certified through the BCMSA, I encourage you to reach out to WorkSafe BC to confirm eligibility first and foremost, to ensure that you don't have any impeding orders or anything of that nature that may impede you from being CORE certified. From there, it's a fairly seamless process. You would fill out a CORE application and submit it to BCMSA. And in there, it's going to include your auditor selection. So you would go on our website, you would look at an auditor that you would like to choose to do your CORE audit and complete that CORE application and send it into Liz Kim, who's our CORE specialist here at the BCMSA. From there, you would complete a notice of audit, which would outline exactly the approximate dates and times at which you would like this audit to take place. And then from there, basically, once we get that notice of audit, 2 weeks prior to you actually taking or going into your audit, we will actually ship out an audit key to you for you to actually perform your audit. So from there, you can actually go in, do your audit, where you would have the ability to go in and do your 3 verification methods and complete all of that. Once you're completed your audit and absolutely complete, you would send it in to us for audit review and decision, where we would do the quality assurance for your audit and let you know whether or not your organization has been approved or not approved based on what the QA analysis comes in. From there, we ask the organizations to complete an action plan, which is based on the recommendations that you've outlined in your audit. From there, we go out and we send that into WorkSafe BC for approval, and then we go through our typical phase. So the next year, you'd go through a recertification phase, and there is a complaint procedure, which again, any organization has the ability to do if they feel that they've been scored incorrectly or do not agree with the quality assurance process. That's something that if the organization feels the need to do, they could always reach out to the BCMSA and we can discuss that in a little bit more detail on how you would go about that. But that gives you the core process in a nutshell. Again, it's fairly seamless. After the eligibility is confirmed, it's really about filling out the application, selecting the auditor, and filling out the notice of audit. And then from there, what we can do is we would ship out your audit tool key, and you can go out there and actually with your license and key, you can perform your audit, send it over to the BCMSA, and we'll do the QA. And hopefully all goes well and recommend you for approval to WorkSafe BC. So the three verification methods, again, are documentation, observation, and interviews. So this is the way that an internal auditor or an external auditor is actually going to be auditing the organization when it comes to the core audit. Documentation makes up 50% of the entire verification methods. It's top heavy. So any organization, I always like to say this, that is going to go for core, it's something that you definitely need to keep in mind when you're preparing for the audit. You need to ensure all of your documentation, as much as it can be, is up to speed and that you have the majority of it complete well before the audit. And again, remember, we're looking at 1 year of record. So when it comes to your inspection reports, your accident investigation reports, your crew talks, tailgate talks, the auditor is not going to be looking for information that's 5 years out. They're going to be looking for something that's relevant and within the last 12 months. That's what they've been trained on to look for. So if you don't have that information, your documentation hasn't been reviewed in the last 12 months, you will not pass. That's something that you have to really keep in mind when you're looking at the documentation piece. The observations, again, you don't need to conduct observations at every single facility within your organization. 1/3, 33% of all similar facilities are observed per year. So if you've got 9 facilities overall throughout community social services, you'll be required to at least visit 3 every single year. There's no requirement that you're going to have to do the entire organization in 1 year. And the thought process behind that is that the first year you would visit 3, the next year you would alternate and visit 3 different ones, and going forward. So every single year you're looking at different facilities and different observations are being conducted on an annual basis. And lastly, interviews. So interviews are a big portion of the core audit and one of the verification methods. And all managers, supervisors, and workers are interviewed throughout the core audit. The requirement is that at least 50% of your overall interviews need to be workers. So that's something to definitely keep in mind. You can't conduct interviews on just managers, supervisors per se. The large portion of your interview personnel needs to be workers and needs to total at least 50%. You can do more than 50%, but you cannot do less. And just some more information on an audit and kind of what this looks like if you're looking for timelines. The documentation review, again, depending on the size of your organization, takes approximately 2 to 3 days, depending again on the experience of the auditor. If you're a fairly new internal auditor and this is your first audit, that may be more on the upwards around a week. But if you're using an external auditor out of the BCMSA catalog, typically 2 to 3 days is more than enough for them to get the documentation review complete. Observations, again, depending on the size of your organization, but if we're going to 3, 4 sites, you're looking at typically 1.5 to 2 hours per site. So that gives you an idea if that's going to take you close to 1.5 to 2 days to really get your observation pieces done. And interviews, again, depending on the size of your organization, the maximum that we recommend when it comes to the interviews is around 25 to 30 minutes to keep consistency. If you're seeing that your interviews are going a little bit longer than that, you really want to try to do your best to cap them at 30 minutes. You don't want them to exceed too much because they do play a part in lengthening your audit as well. And really, the interview questions that you have available and that you are asking personnel are open-ended questions where you should be able to get the response fairly quickly and get a good idea of the outcome of that interview rather than extending it longer than that time portion. Core audits. So again, the year 1, I like to mention this because this is the life cycle of the core audit for those folks that are interested and need more information. The first year, again, needs to be through an external auditor. So if you're going through the BCMSA, you would need to go on our website and you would need to be certified through an external auditor. Years 2 and 3 are what we call our maintenance audits, and you have the ability to train someone from your organization to become an internal auditor and conduct those maintenance audits for you. You can choose to always use an external auditor. That's totally up to the organization, because some folks feel, and it is a lot of work, so that's something that we do let folks know, is that, typically, again, to complete an entire audit, depending on the size of the organization, can take upwards of 3 to 4 weeks. So that's something to keep in mind when you are looking at workloads within your organization. But you do have the ability to train personnel to become an internal auditor for years 2 and 3. And year 4, which is your recertification year. So year 1 would be your certification, year 4 would be your recertification. That again has to be an external auditor. So the requirement is years 1 and 4 are mandatory, will be an external auditor. Years 2 and 3, ability to have an internal auditor if you choose. And lastly, I want to go a little bit about the benefits of COR here. And Bao did a really good job of outlining what some of these benefits were for his organization throughout your sector. He spoke a little bit about this as well, making a strong statement about an organization within your organization. Employers may be eligible to receive up to 10% in annual incentive payments from WorkSafe BC. And over time, really critical, with reduced injuries and lower claims costs, core organizations experience rating WorkSafe BC premiums will reflect additional savings. So one of the really cool things about the core program that has been identified through research and verified through research is anybody that is core certified typically sees a reduction in their WorkSafe BC premiums. So there's a direct correlation between those core certified organizations and lowered injury rates and illnesses throughout those organizations. So it's definitely making an impact, and you're seeing some cost savings and reductions in there. But most importantly, you're looking at the health and safety of workers throughout your organization, and something that should be top of mind for everybody within the core program and their organization when it comes to. I like to bring this up as well, because this gives some folks a real-time sort of a value of what this looks like. Now, keep this in mind, because we are the BCMSA and the Municipal Safety Association. This is around a small to medium-sized municipality within BC. But you can see here, this is the formula that's used to calculate your incentives. Again, the driver should never be the incentive per se. We're always looking at worker health and safety to be top of mind when it comes to the core program. But the reality is that there is an incentive definitely that is attractive to employers. And if you're practicing and promoting good health and safety, you can see just how much that incentive can be, and how you can reinvest some of that, some of those rewards and monies throughout your organization to provide for a better and more holistic health and safety program. And some suggestions when it comes to using your incentives. You can reinvest the incentives to help reduce claims costs. So exactly is that you can reinvest that to your health and safety program. You can hire additional personnel to help manage the core program going forward. Additional safety resources or training. So you'll see that outlined throughout your core audit. You'll see recommendations that may be made on training. You may need to do updates on your safety program. You may need to do updates on your LMS system, whatever that may be. That's different ways that you can use these incentives to help promote and help update some of those programs and procedures if need be. And you're using your future incentives to hire external auditors to minimize the cost for the organization as well. So there's different ways that you can go in and reinvest the money that you make off these core audits, and help promote health and safety throughout the workplace. And I see that done throughout many of our core certified organizations. Predominantly, I'd say a good amount of them are doing that and reinvesting it throughout their health and safety program. Some other feedback that I like to share from our core certified organizations, and this is fairly recent feedback, and that's why I wanted to bring this up, because it's quite relevant to this presentation that we're talking about. But it creates and promotes a safer and healthier workplace. So some of the feedback that we've heard is, health and safety was always there in the workplace, but by becoming core certified and really getting that gold standard and really showing safety excellence, it's really brought safety to top of mind. Not only workers and supervisors, but management, really seeing what the benefits around health and safety are, and just keeping everybody safe and promoting that safety is really changed since they've become core certified. It strengthens the organization safety management system. So we talked about not only from a programs and a procedural method, but you're seeing that injuries and accidents are going down in the workplace. You're seeing that you're not seeing as many accident investigations. Inspections are getting better because people are more trained and they have a better education around health and safety. So you're just seeing an overall improvement in health and safety throughout the workplace. And again, a financial benefit. So that's something that we've definitely seen feedback. They've reinvested that financial benefit in their health and safety program, which again has reduced their injuries and claims duration because they have additional personnel that will be monitoring and evaluating claims and return to work for their organization. Some advice moving forward, if you are interested in the COR program, if you're really green and just kind of at that elementary stage and kind of looking at, okay, well, we may not necessarily be ready for COR, but we want to start somewhere. A good start to that would be doing a gap analysis of your safety management system. So what you could do, and it's an option that we always put out there, is you could reach out to some of our external auditors on our webpage, and totally independent of the BCMSA. And from there, you could hire them to do an external audit to perform a gap analysis for yourself. So not an external audit, but just a gap analysis to kind of get the flavor and the scope of how your organization is doing when it comes to health and safety. I know it says 2,500 to 4,000 there. It could be less depending on the size of your organization. But really what they're going to be coming in is looking and doing a real evaluation and seeing where you need to make some improvements that could help you go for COR in the future. And internally, we do have a COR tool, gap analysis tool, free of charge on our website. So if you choose to do this and you would like to do it yourself throughout your organization, we're actually in the midst of updating it right now, but you can find it on our website under our COR section. And we actually have a COR gap analysis tool that you can use and do an audit independent of the BCMSA or any of our auditors, and take it on and basically go through every question and see how your organization scores and basically stacks up against our COR audit. The really cool thing about our COR gap analysis tool is that all the questions from the COR audit have been embedded in there. So you're actually getting the audit beforehand, and you have an ability to measure yourself on how you would do in COR before actually going for COR. The other advice that I'd have is if you are looking at becoming an internal auditor, taking our internal auditor training. So something that we've done here at the BCMSA in 2024 is made that training absolutely free for all of our members and in any of our naturally aligned organizations, which would be yourself here in the community social service sector, and Safe Care BC as well. If anybody here is on from the Safe Care BC's community sector as well. So the reason why we bring up internal auditor training is if you're ready to go for COR and you're looking at becoming certified and you want to be an internal auditor, great. This is training that we can definitely put on, and we'd encourage you to take part in it. But if it's something that you're just looking at saying, well, I want to go for COR, but I want to get some more understanding on how this actually works and how this is going to impact our training, this is a great tool to use for that as well, because you're going to get knowledge and understanding how the audit and the actual auditor works. So you could take the 2-day course and you could actually look at all the different nuggets that are in the fundamentals around auditing. And then from there, you can use this to help prepare your organization for COR. And it's, again, free 2 days of training. There is a student audit piece that's related to it if you want to be certified as an internal auditor. So it's a 2-day training course, 2 full days. And then from there, the other caveat to it is that you would need to conduct an audit throughout one specific division/department of your organization. But we can talk about that a little bit more if that's something that you're interested in doing and want to move forward towards. Again, we talked a little bit about this, so I'm not going to go too much in depth, but if you are looking at going for COR, you'll have to hire an external auditor as part of your certification year. And it's going to depend, and it varies on the size of your organization. So when it comes to cost, timelines and all of that, we gave you kind of a broad spectrum of what that looks like, but depending on how big or small your organization is, the auditor is going to be able to give you a good idea of what that looks like. And when you're hiring a consultant/external auditor for the BCMSA, the way that it works is you would reach out again on our website, but you're going to work with that auditor to create the scope of work. So really look at how many interviews you're going to be conducting, how many observations they're going to be doing, and how many sites are going on, and what that whole documentation piece looks like. So we do have a specific formula that calculates that, but they are going to communicate all of that and work with the organization to see what that looks like. And you create an organization action plan through that. So they're going to, again, help create the fundamentals around that, but the organization is definitely going to play a major piece in seeing what that looks like. It's important to be prepared before the audit. It helps minimize costs. It helps in the communication piece with the auditor and just makes for a much well-rounded audit. So I encourage you, if you are reaching out to an auditor and you would like to set kind of the parameters of that audit, ensure that you're prepared and have all of that upfront so that both parties can really hone in and make sure for an efficient audit. And lastly, just we'll leave the Q&A again for the end here, but if you need more information, feel free to reach out to myself at the BCMSA or Liz Kim, who's our core specialist. So Liz does a phenomenal job in doing the training with us. We also have Drew Razers, a part of our core teams. Both of those folks are predominant trainers. I help out as well on an as-need basis, but they look at that and they look at the QA side of things for the BCMSA. So anytime you need any information, you just want to run something by, or you want to see if your organization is ready for COR, we'd be more than happy to help. So please reach out and we'd be happy to speak further.
Thank you, Justin. That was a superb, presentation. I was actually thinking about questions for you, but you covered everything miraculous, like absolutely on point. There is a free assessment tool that's on your site as well. I encourage employers that are wanting to explore it that they use that tool. It's very effective. And again, thank you so much, Justin, for your presentation. It was very, very well done. Our next speaker is Farsad. Farsad, please take it away.
Sure. Thanks, Sat. Like the other presenters, I'm also going to be sharing my screen here. And then while that's coming up, I just want to just reintroduce myself. My name is Farzak Assad. I'm a Senior Labor Relations Officer with the Health Sciences Association of BC. Our union supports about 18,000 members in BC in the healthcare sector in a range of acute and long-term care facilities, and then also in the community and social services sectors as well. So I'm going to present about the worker perspective, and I think Bawa and Justin have done a great job of sort of laying out what the COR process is, how you go about achieving COR, and my role is to make sure that the worker lens or the worker perspective is also considered and where the worker actually fits into the COR process and actually achieving COR. So some of the contents that we're going to be discussing in this presentation are engagement and building a culture. So I know Sat proposed 2 questions, at the beginning of this webinar as well. And, your thoughts, I encourage you as we're going through this to really think about, engagement and what an actual effective health and safety culture looks like. And then we're going to dive into some worker participation modules and the Joint Health and Safety Committee and its vital role in the COR process as well. So engagement, there's 4 factors which I really consider to be crucial when we're talking about engagement. Those are vision, transparency, feedback, and measurement. So when we talk about vision, it's about making sure that the organizational strategy is aligned with the health and safety strategy. So are we looking at, and the vision also often ties into the health and safety policy statement at a facility and a site as well. And these have to be updated on an annual basis. So when we start with building a culture, the vision is really the roadmap as to what the organization wants to achieve, like organizationally, and then also from a health and safety perspective, what are its goals, right? And I think one of the advantages of the COR model is that it very strategically and systematically lays out what you need to do to get above a minimum standard for health and safety in the workplace. And so when we're looking at engagement, I think like one of the it all starts with the organization's vision of where they want to go, and then how do we live that vision every day. right? So I've been in previous organizations where the executive leaders, some of the executive directors, the vice presidents would be the ones conducting safety audits on site to sort of promote and push that example of, we're all in this together. It starts from the top, and workers notice that, right? Like workers are going to be able to tell what an effective health and safety culture looks like and what it doesn't look like. So I think it's a really imperative in the first stage that we get the vision right, and we want to move forward with that vision in everything we do. When talk about things like transparency, really here we're talking about communication, and more importantly, two-way communication. So how transparent are supervisors and managers with their policies and procedures, what goes into those policies and procedures. The other aspect of COR that's nice as well, and I think Justin covered this nicely as well when we're talking about internal and external auditors, is that the checklist is available, right? So anything that has been developed with us at the working group has then been pushed down, and that we are officially using these sort of core documents to see what are we checking off, what are the questions that are going to be asked when we go through the COR process. And I think workers appreciate that. And then when we're talking about feedback, we're talking about avenues for feedback, implementation of feedback, trust in the process on the workers' part as well, right? So if workers, we talk a lot about gap analysis in COR, right? So if workers do identify gaps, if they do provide feedback, that feedback is effectively followed up on and in a timely and efficient manner. I think workers do really appreciate that, and helps build that culture as well. When we talk about measurement, we're usually here talking about things like engagement surveys. I really love that Bawa in his start brought up the psychological health and safety standard that we're trying to implement. That's been a big goal of not only our union, but many other unions as well. The Guarding Minds at Work survey, which pretty much is a survey tool for organizations on how they're doing with respect to the 13 psychosocial factors that Bawa mentioned there. So I think it's always important to get a pulse check on how your workers are doing, and check in on them on a quarterly basis, on an annual basis, and make it as regular as possible. So when we really talk about engagement and building a health and safety culture, I really believe that these four elements have to be present, and they all are interconnected. You can't have one without the other. And especially on the workers' part, when we're looking at engaging workers, when we're talking about bringing workers and merging them into the health and safety strategy, into the organizational strategy, I think we are really looking at, and I think the COR process will help with this as well, but we are really looking at workers to really participate in this process as well. So when we talk about worker participation, one of the key amendments in OH&S regulations as far as WorkSafe is concerned is something that's ongoing right now. I've actually sat in on some pre-consultation sessions, but it has to do with the way that workers participate and the way that they're consulted. So just for reference, these are proposed amendments to the regulation under Part 1 on the definitions, and then Part 3, the rights and responsibilities, and then Parts 4, 5, and 8 in WCB's 2022 to 2024 OHS regulation work plan. So the reason I think that this is going to be important moving forward is that currently, with the way that workers are consulted, with the way that they participate in OH&S processes, we've had a lot of feedback from our members that very often, workers are not the first contact point. And I really do believe, because workers have a lot of that frontline experience, they are the ones conducting their work tasks and activities on a regular basis. I really feel like they should be a central point of contact for feedback, for consultation, and for participating in sort of implementing these sort of policies and procedures in the workplace. So I think the regulation change will put more responsibility on all parties, right? So it's going to be put more pressure on workers to sort of provide feedback, on the employer to sort of take into account how workers participate in their organization. and I'm looking forward to seeing how those changes are implemented. And a fundamental principle for worker participation is simply that workers are at their best when they're engaged and they feel heard. So just going back to that feedback, that slide about those 4 factors, I think the feedback stage is really important, because when workers do provide feedback, they'd like to acknowledge that their voice was heard, that the employer took action, and when they did take action, they effectively solved an issue, or took employee feedback into account when solving an issue as well. So there's a need for consultation and participation in these processes and procedures at all times from workers. And then when we're talking about COR, I think we also need to, obviously your gap analysis and your feedback loop will be taken into account on an annual basis when you look at your questions and when you look at how you're going to move forward with reviews. But we also need to think about a couple of different things. We need to think about WCB's high-risk strategy for what they believe are the 3 top priorities for the community and social services space. Right, historically, it's always been the workplace violence, the MSIs, the musculoskeletal type injuries, and communicable diseases. So I think a plan in tandem with WCB's high-risk strategy is important when we're talking about how to effectively account for risk management in the workplace. So what are the risks now? And then what will the risks be 1 year from now, right? So thinking ahead, how is violence, for example, just taking violence as an example, what are the trends of violence right now? And how do we see it trending a year, 2 years from now? And what are we going to be putting in place as far as risk assessments are concerned to effectively control that? And then the oversight of COR program, are the questions still meaningful and relevant? One thing that I really appreciated was the COR working group, where we got a chance as a union to provide feedback into the process as well. Because we also have a lot of good experience with feedback that our members have given us. And we get to see firsthand whether the questions are still meaningful, whether they serve a purpose. And it's all about the execution of this COR program going forward, right? And I think Justin and Bawa have really nicely laid out that, it's not just about premium reduction or cost savings. It's about having an effective health and safety program, about having an effective health and safety culture moving forward. And I do really think that if the COR process is used correctly, that these elements will meaningfully follow. And then a point on the joint health and safety committees, they are really a central piece of engagement in the workplace. So the engagement of the committee and investigations, in participating in investigations, something we hear a lot from our members sometimes is that they're not consulted when an incident takes place in the workplace, even though they were involved in the incident. So really taking the time to ensure that the incident reports have been filled out, that they've been provided to the committee, that the investigations have been signed off by a committee, 2 committee reps, and that the Joint Health and Safety Committee is actually acting as a conduit for other workers to really see what's being discussed at meetings, and then how do they effectively control and reduce incidents in the workplace. So consultation and participation is key. Support for the committee, making sure that our Joint Health and Safety Committee members have sufficient prep time in order to prepare for the committee meetings, in order to prepare for incidents and investigations, and do their inspections in the workplace as well. The responsibilities of the Joint Health and Safety Committee may change over time, and this is kind of more towards the point of looking at our risks in the workplace and how do risks evolve over time. One thing that HSA has been lobbying for quite a while is the involvement of the Joint Health and Safety Committee when it comes to identifying, investigating, and evaluating psych injuries in the workplace. This would obviously be a huge shift from what the Joint Health and Safety Committee does now, right? So right now there's a clear sort of delineation between the Joint Health and Safety Committees and their purview on incidents. There's certain types of incidents that don't make it to the Joint Health and Safety Committee level right now, and those include psych injuries, bullying and harassment, and those are typically handled by a separate department, right? Usually handled by the HR department. So what HSA has and other unions as well have been lobbying for is we need to bring the Joint Health and Safety Committee into the process of actually now getting involved, identifying these types of hazards, looking at the Guarding Minds at Work survey, looking at the CSA standard for psych injuries and psych health and safety, and determining where the organization currently is with respect to those factors and where they want to go. So keeping that in mind, when we look at the COR process, if it ever comes to a point where the Joint Health and Safety Committee is now takes on new responsibilities, since they're such a central part of the health and safety system in any organization, I think the COR process will need to account for that with questions whether if you want to obtain COR, then here's an added element of what you need to consider, right? And I hope that the organizations and that WorkSafe BC as well is heavily participate in that as well, because I do think that's important. And with that, any questions? I'll leave that till the end. Yeah, thank you very much. And I really enjoyed being part of this webinar.
Thank you, Farsad. That was an excellent presentation. I really liked your engagement slide. It really, promotes transparency, understanding, and communication in this particular arena. Health and safety committees are hugely underutilized in our sector. This is my own personal observation, and it's critical that, go to that source, work with your employees, build the capacity of reviewing good policy and process. Just a couple of quick hints as we move into sort of the Q&A, some suggestions for you as you're considering to potentially engage in this process is be aware of your policies and procedures. Are your policies, procedures transmitted, and are your staff aware of the policy and how the process or the procedures are applied? Can you examine those things and be able to evaluate them in a timely manner? I think that Justin's point, the sort of investigative, evidential mantra around, observation, documentation, and interviews is so critical. And apply that in your organizations when you're looking at this program. And so with that, I'd love to open it up to everyone for questions, comments, any suggestions or whatnot. You're most welcome to. And I encourage my panel to come on screen with me. My goodness, we don't seem to have any questions. It seems that the presentations, did such a marvelous job. There's not too many questions at this point in time. Again, a call for questions, comments, suggestions. So, what does health safety culture define to you as? Oh, we have a question here. What is the minimum organization size recommended for COR? Great question. Justin?
There is no minimum size. So we've got both small and large employers. Anybody over 20 is classified as a large employer here within BC. But if you are even an owner operator and you've got 1-2 folks within your organization, we have many certifying partners that would just certify you through COR. So here at the BCMSA, what I can tell you is we typically don't get a ton of small employers. But if that is the makeup of your organization and you do have less than 20 employees, that does not deter you from going for COR. By all means, reach out and we'd be more than happy to certify you if you've got the ability to get COR.
Thank you, Justin. Another great question. Can you provide a link to a gap analysis tool? One of the things that I encourage employers to do is to go on their WorkSafe health and safety portal, the employer safety planning toolkit. Access that. And there's some incredible information that you can pull from that, from specifically from your organization. What I love about this tool, when I was doing the work in the pilot, I did those gap analysis for 30 organizations over a 4-year period. They're just priceless. Not only will it help you in your core, but it will help you in as from an organizational standpoint of what's going on and what's happening. Farsad touched on that as well. And actually, Bawa spoke to it on the practical applications of it. And so I'm hoping that, and it's also at WorkSafe BC. I would definitely encourage you to access that website as well for a gap analysis overview. But if not, you're welcome to reach out to me, and I'll give you a basic template if not successful. And I know that Justin's group has an outline as well. Great question. So what is health and safety culture, folks? Any comments? And or who leads health and safety? All right. You know what?
There's a question of, if training an internal auditor, should it be a manager or staff person?
Justin.
Thanks for that question. It can be anyone that's has a role within health and safety. So I've had organizations where it's a worker, some that have a manager, supervisor. The thing to keep in mind is that you have a baseline knowledge of health and safety, and you're committed to auditing. That's the most important thing, because one thing that you need to keep in mind is that when you are doing an internal auditor, again, harping on it a little bit here, but it does take up a significant amount of your time, typically anywhere between 2 to 3 weeks of your full-time job. So it's not something that you can just do off the side of your desk. You definitely need to have a knowledge in health and safety, and you have to be committed to the process. But other than that, whether it's a worker, supervisor, or manager, we've got workers and supervisors on JOSH committees that are internal auditors as well.
Excellent. Thank you. Great question. There's some other comments that have been put forward. Anna, please feel free to speak to them.
Someone is asking what you were saying with regards to searching on WorkSafe BC using the CU number. What does that look like if someone wants to search on WorkSafe BC for their CU number?
So there is, and I don't know it off the top of my head, but you can reach out to our team here, or you can simply just go on WorkSafe BC's the partners program, and they have an area there where you can put in your classification unit number. And basically the reasoning behind that is that you put the number in and it will automatically assign you to a certifying partner. So it's not just the BCMSA, we have other certifying partners here throughout BC, but that's one way for you to kind of finalize who WorkSafe BC would kind of direct you towards if you're unsure whether or not you fall under the BCMSA purview. But you simply go on WorkSafe BC, put in your CU number, I believe, and then from there it is going to automatically link you back to a certifying partner and a health and safety association.
There's another question. Sorry, go ahead, Anna.
Is the self-assessment on the BCMSA site the in-house gap analysis tool?
Yes, so we do have great question. We do have a gap analysis tool on our BCMSA website that is works in conjunction with the COR audit. So again, it's the questions that are part of the audit. We've actually taken those and made that as part of the gap analysis tool. You can reach out to Liz Kim. You can find her contact details on our website. It is there, but my only caution is it is being updated right now. So it may be down for, say, a week per se, just because it is going down through that customization piece right now. But otherwise, it's absolutely free use and available to anybody that's going through the COR program.
Thank you. Great comment around leadership. Team has to set the example on promoting health and safety culture. Excellent. And then provide the vision by, but then everyone has to participate, and everyone who knows the vision and takes pride in the work. Yeah, absolutely. Bang on. That's a lovely comment. And then we have health and safety must be led from the top. to truly be rooted in an organization. Workers lead health and safety throughout their actions. That's fantastic. And you know, part of the core component, the fundamental piece is, you're 100% right. It's led from the top. You know, there is a mandate that's posted on every site that's signed off by the CEO and executive director. And so that's right on the money. And I guess there's a question around the 2 free auditor courses at the BCMSA, where they could find that on your website, on the
Yeah,
BCMSA.
that's right. That's right, Sat. So we've actually got 4 coming up this year. I believe the first one is in February. So if you go on our BCMSA, www.bcmsa.ca, and you look under our calendar section, you'll be able to see all the 4 dates that have been outlined for the internal auditor course. And again, absolutely free of cost. You can do them either in person or you can do them virtually. So if you're situated throughout the province of BC, you don't need to travel all the way down. A lot of the times, actually, some of our courses are absolutely virtual. But if you are here in the Lower Mainland and would like to come out to our office and do the training, by all means, we provide an option for both 2 different models for our naturally aligned organizations and core membership.
Thank you, Justin. You know, all the presentations have all these golden nuggets that can make a little mound of, you know, gold. You know, so we're looking forward to posting that and getting that out to you as soon as we can. Any other comments before we go around? Go around the panel at all? Is there any other final comments? Justin, do you have any comments before we close?
Sat, I'm just happy that you know, I was able to be here, and thank you for inviting me around this extremely important topic. And thank you to the presenters. I think Bella did a great job, and Prasad did a great job, and really outlined the importance of health and safety. Really honed in on the worker perspective, as well as the impact that it has throughout organizations through community social services. And you know, for me, it's really about just being a resource for the industry. So if there's any questions at all, by all means, feel free to reach out. I'm more than happy to set up some time to go through what the auditing looks like and the ways that it may impact your organization. So again, we're here to help and we're here for you. So reach out whenever you need.
Thank you, Justin. Prasad?
Yeah, no, nothing further from me. I just want to thank the panelists, the presenters. I thought Justin and Bauer did a great job outlining the requirements for COR, and just really enjoyed being part of this whole presentation. Thank you to you, Sat, Anna, and Mandy as well.
Thank you, Prasad. Mandy, do you have any comments?
Hi, everyone. If I can leave you just with one thing, it's, I guess, the only thing for today from me. But if you haven't started already, and all of the presenters today did a very good job at reiterating this, and many of you out there, I think, feel this way already, is what health and safety and who leads that. And that is the leadership. So if you can go and take this presentation or take what you've learned from it and start those conversations with your CEO, your executive director, around what that could look like for your organization, I think that's a really important piece in getting everybody on board and starting to talk about what the vision is, where you want to go with this, what's that going to look like for you. But it does start with the leadership of the organization. And I think that is the first step. So thank you, everyone, for attending today. Thank you, panelists. You were amazing.
Thank you, Mandy, for being part of the group this morning. Bawa.
Yeah, thank you. Also, Seth, for providing the opportunity to share a little bit about COR. And I also want to thank Farzad and Justin for all the great information around the COR certification and really the benefits, right? That's really what it's all about. And I do believe organizations are better off when their health and safety program is solid and effective, and COR is such an important tool in order to achieve that. So, you know, so I'm hoping our presentation has contributed to giving organizations some ideas on where to start with that if they haven't done so already. So yeah, so thank you.
Thank you, Bawa. So with that, I want to express our gratitude to Bawa, Justin, Mandy, and Farzad for their presentations. And most importantly, the work that they are doing to support what is in the best interest for the community social services sector. So these folks are here in the best interest of everyone to help move health and safety forward. And so I commend you all for that. I want to acknowledge the advisory panel that, really supported this initiative at the beginning of the year. These webinars are a tremendous amount of work in the background. I had to also thank WorkSafe BC, our sister health and safety associations, Mike Roberts at the BCMSA, and Salima Dalaf at Safe Care BC, in being extremely instrumental in supporting this initiative. Together, we make a difference. And a big thanks to Anna and to David for making all the hard work in the background to get things rolling. Most importantly, we want to thank you for participating in the session today. Your time is extremely valuable, and we try to do our very best to provide you a maximum amount of information in an efficient manner that you can utilize the materials that we're presenting. And with that note, I would like to conclude this session and wish you an absolutely fantastic week. Have a wonderful day.
Thanks, everyone.
Thank you.